pipe, you can stay high for a day.
The most addictive illegal drug in America.
Especially if they're using methamphetamine that has a distinct deteriorating effect on somebody's physical appearance.
What if America's real crisis isn't the tents, the sidewalks, or the breaking news stories, but something drifting quietly through every big city after dark? From Skid Row to Kensington, an unseen force, cold, relentless, and unforgiving, is reshaping entire communities. It never sleeps, it never slows, and it never hesitates to claim another life. We thought we understood the homeless in America. We were mistaken.
I actually started doing meth to stay awake because of the fact of waking up. And I was scared.
How the crisis turned silent before it exploded. When people talk about the homeless crisis in America, they usually imagine tents under bridges, crowded sidewalks, or someone trying to sleep on cardboard. But what's happening out there goes much deeper than the scenes we see. For years, a quiet storm has been forming a public health crisis that didn't blow up overnight. It grew slowly, quietly, inside a system already pushed to its limits. The U.S. Department of Housing and Urban Development recorded over 653,000 people homeless in America in 2023, the highest ever, with a 12% jump in a single year. That spike didn't happen because shelters vanished. It happened because the support system meant to protect the most vulnerable has been breaking for decades. During that same time, meth use swept through major cities.
It gives you a euphoric rush. It's like your whole body tingles all over the place, and it's a good feeling. Happy, giddy, but then when you come down off of it, then people start wanting more, and they go crazy, and that's when they lose themselves.
The National Survey on Drug Use and Health reported 2.6 million Americans using meth in 2022, with even higher rates among those living outside. Outreach teams in Los Angeles, Seattle, and Phoenix say meth-related mental health emergencies now happen every day. But the crisis didn't begin with meth. It began with failing systems mental health care that's too hard to access housing costs that suffocate working families and government support that never kept up. A 2022 study showed nearly 30% of homeless adults struggle with serious mental illness, and most never get steady treatment. Those cracks kept widening, and meth flowed right through them.
I use methamphetamine. I have a severe attention deficit problem, a borderline narcolepsy.
And the silence around it made everything worse. For many Americans, homelessness still feels distant, like it's happening somewhere far away. But every camp, every overdose, every person sleeping outside is a sign of a deeper breakdown. This crisis didn't come out of nowhere. We saw the signs, we ignored them. And now the reality is right in front of us, harsh, visible, and impossible to turn away from. Why meth became the street's survival tool. On the streets, meth isn't seen as a party drug. For many people, it has turned into a survival tool, a way to stay awake, stay alert, and stay alive. When you're homeless, every night feels dangerous. You sleep lightly. You carry everything you own. You face theft, assault, cold weather, and uncertainty. In that kind of life, meth becomes a kind of shield, risky but useful. A UCSF study found that roughly 1/3 of homeless adults in big cities use meth several times a week, often, because they're trying to stay safe, not get high. One man told outreach workers, "I don't use meth for fun. I use it because I'm afraid to fall asleep." Hearing that changes how you see addiction among the homeless in America. Meth cuts hunger. It gives energy when your body is drained. It keeps you moving when you don't have a safe place to rest. For people dealing with trauma or untreated mental illness, it becomes a fast, cheap way to push fear and pain away. But the price is heavy. The CDC says meth-related overdose deaths jumped almost 50% between 2019 and 2021, hitting people already living in unstable conditions. Meth destroys the mind long before any help arrives. Paranoia, hallucinations, and full psychosis are now common in encampments across the country. And here's the hard truth: the system was never designed for people in this deep of a crisis. Most treatment programs expect stable schedules, IDs, clean tests, or insurance. But more than 70% of homeless individuals don't have steady access to healthcare, so staying in treatment becomes nearly impossible. And the cycle keeps going. Meth helps people survive the streets, but it also keeps them trapped there. It fills the gap left by systems that broke down long before someone ever picked up a pipe. Inside the encampments, where meth shapes the rhythm of survival. When you walk into certain encampments across the country, you feel the tension before you even see anything. The air feels heavy. People move fast, alert, always watching their surroundings, even when nothing is happening. This is where the homeless crisis in America hits the hardest. Here, meth doesn't just appear, it sets the pace of daily survival. In places like Skid Row, the Tenderloin, and the stretch people online call Kensington, Philadelphia meth, the usual rules of society don't exist. These areas turn into survival zones built from whatever people can find: tarps, broken furniture, scrap wood. But inside the chaos, there's something else, an informal system created by the people living there. They warn each other about dangerous batches. They share food, water, blankets, and sometimes a moment of calm. They help newcomers. They check on someone who seems off or hasn't moved. It's messy and fragile, but it's still a community formed out of necessity. But meth changes the energy. It speeds up everything. It turns small problems into fights. It heightens fear. It keeps people moving even when their bodies need rest. And when paranoia hits the pacing, the whispering, the sudden panic, the entire encampment feels it. This is why harm reduction services are so important. Outreach teams bring clean supplies, basic medical care food, and crisis support. They're not promoting drug use. They're trying to keep people alive long enough for treatment to even be an option. Without them, this public health crisis would be far worse. But even with help, life inside encampments stays harsh. Meth becomes both a tool for survival and a trap that pulls people deeper in. And for most Americans, driving by this world stays invisible. If you really want to understand homeless in America, you have to step into these hidden spaces, the ones most people never see, and witness what's happening up close. When the mind breaks, faster than the system can respond. There's a moment you see over and over on the street, a blank stare, drifting eyes, someone talking to a person who isn't there. It's the quiet sign of something deeper, a mind falling apart long before any help shows up. And this is where the crisis shifts from addiction to something even harder, a mental health emergency happening right in front of us. Meth doesn't just drain the body, it overwhelms the brain. People pace for hours, terrified of dangers that don't exist. Some hear voices. Some argue with empty space. Others freeze, unable to understand what's around them. In many encampments, meth-induced psychosis is as common as hunger or cold. That's why mental health awareness isn't optional. It's essential to understanding what's happening. Studies show a large share of people experiencing homelessness already live with untreated mental illness. When meth enters the picture, everything intensifies. Trauma gets louder. Memories turn into panic. Fear becomes constant. And still, the system almost never responds fast enough. Hospitals release people in hours. Crisis teams are overwhelmed. Long-term psychiatric care is nearly unreachable without stability or paperwork. Many treatment programs expect people to arrive sober on time, and with documents things nearly impossible for someone in active psychosis. Outreach workers say they may meet the same person dozens of times before that person is calm enough to even talk about treatment. By then, the damage is deeper. The breakdown has already started. This gap between what people need and what the system can actually give is where the public health crisis becomes undeniable. We are trying to treat addiction without treating the mind that's already been pushed past its limits. We offer short fixes for long-term wounds, and we expect stability from people living in total instability. The truth is simple. If we ignore the mental health side of this crisis, addiction will keep winning. And the people suffering most, those outside alone, terrified, will keep slipping through cracks in a system too slow to catch them. The system that arrived too late. Why help never meets the street in time. When you sit with outreach workers, you hear the same frustration every time the system was never made for people living in constant crisis. On paper, America has shelters, clinics, hotlines, and addiction treatment programs. But on the street where danger comes every night, most of those resources feel far away, too slow, or nearly impossible to reach. Capacity is one of the biggest problems. Shelters across the country fill up almost every night. In cities hit hardest by the homeless crisis in America, some providers say the wait lists run for weeks. And when someone is living hour to hour, even a 24-hour delay can mean losing the only moment they were ready to ask for help. Medical services are stretched just as thin. Many harm reduction teams have tiny staffs covering huge areas. Detox beds are scarce, and mental health units often turn people away unless they're in immediate danger. It's not because workers don't care, it's because the whole system was built decades before today's public health crisis exploded. Government support hasn't kept up either. People who try to join programs run into mountains of paperwork, ID rules, and steps that assume stability, a phone, an address, a safe place to keep documents. But when everything you own fits in one backpack, those rules become barriers, not help. One statistic says everything for every 100 extremely low-income Americans, only 33 affordable housing units exist. That gap forces thousands into encampments where meth becomes part of surviving daily life. And even when someone is finally ready for help, the window is tiny. Addiction doesn't wait for office hours. Trauma doesn't pause until a caseworker returns a call. People slip through the cracks simply because the help they need arrives days, weeks, or months too late. This is the center of the crisis, a system built for stable people trying to serve those who have no stability at all. Until we close that gap, the streets will keep absorbing the fallout. Breaking the loop and the human cost, we can't ignore. Breaking the meth cycle on America's streets takes more than good intentions. It takes consistency, long-term care, and support that stays with a person through setbacks, not just their wins. But most solutions in America are short-term. 3 days in detox, a week in a shelter. A quick referral with no follow-up. None of this matches addiction shaped by trauma, fear, and daily instability. Substance abuse rehabilitation programs work for people who already have support. But for those living outside battling paranoia, untreated illness, and survival-level stress, these programs feel out of reach. Many require sobriety, steady appointments, or a stable environment, things impossible for someone who's still trying to survive the street. Housing First models show real results. Cities using this approach see housing stability rise by as much as 80% for chronically homeless adults. Harm reduction, clean supplies, mobile medical teams, crisis response, street outreach keeps people alive long enough for recovery to even be an option. Communities with strong harm reduction programs see fewer overdoses and higher engagement in addiction treatment programs, But even these tools can't work alone. Real progress requires cooperation between city-state and federal systems, plus real investment in government social support. And the human cost of doing nothing is unmistakable. Sometimes the silence after leaving an encampment feels heavier than any sound. Once you see someone sitting alone on cold pavement hands, shaking eyes wide with meth-fueled fear, they stop being a number. They become a person. Teachers, veterans, parents, workers, people who once paid taxes and lived stable lives can fall through the cracks in a single year. Society often ignores the warnings. Meth-related emergency visits doubled from 2015 to 2022, many involving people experiencing homelessness, yet most Americans never witness it. For every person who survives, many disappear. Overdoses, hospital releases back to the street, missed appointments. These are everyday realities. Every face in an encampment tells the story of a system-failing addiction, treatment programs stretched thin, harm reduction services limited, and government social support unable to keep up. If we want to understand the homeless crisis in America, we can't stop at numbers. We have to see the faces, hear the voices, and recognize what's happening in places most people never go. Breaking the loop means building systems that adapt to life on the street, not forcing people to fit into systems that don't match their reality. It means accepting that addiction has no quick fix. It's a long road. And until society commits to walking it, the streets will keep paying the price. At the edge, America's choice. We're standing at a crossroads. Ignoring the homeless crisis in America or pretending meth addiction is someone else's problem is no longer possible. This crisis exposes deep cracks in our system, weak mental health awareness, underfunded addiction treatment programs, limited harm reduction services, and poor coordination between local and federal agencies. Some push for enforcement, sweeps, cleanups, arrests. These have never worked, not in Skid Row, not in Kensington, not anywhere. Others call for housing-first strategies, long-term care, and community support. These approaches show real promise, but require patience funding and long-term commitment, things most cities struggle to maintain. The real path forward sits in the middle. Compassion must meet accountability. Treatment must meet stability. Outreach workers, medics, and volunteers on the street prove what's possible. Cities with strong harm reduction services see fewer overdoses and better engagement with addiction treatment programs. Stable housing gives people the time and safety needed to access mental health care. Meth is more than a drug issue. It's a reflection of years of neglect, underfunding, and broken systems. People living through this crisis deserve more than basic survival. They deserve dignity, stability, and a real chance to recover. Every life matters. Every life is worth fighting for. If this story moved you, you can help. Even a small donation to shelters, harm reduction groups, or addiction treatment programs can save lives. Supporting this channel through memberships, super chats, or donations helps us continue reporting on the homeless crisis in America. Every contribution helps keep these stories alive and ensures every voice is heard. The question is simple. Will we keep looking away, or will we finally choose to fight for every life out here?